You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. A new procedure, all on 4, allows denture wearers to get rid of their dentures. In fact, in one day, 4 dental implants, according to my first guest, can give you something fixed in your mouth. So if you're missing one tooth, a few teeth, and especially if you have a loose-fitting denture, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Baghdasaryan. Dr. Baghdasaryan, welcome to the program.
Thank you, Randy. It's my pleasure to be your guest.
Now, before we get into today's topic, tell us a little bit about your practice. I guess your wife also is in business with you.
Yes, we met in dental school. We got married. We are married for 14 years.
Love at first sight, you said,
yes.
in dental school.
We have 2 gorgeous kids. We want to have the 3rd one, working on that.
All right. Now, the 2 offices, I mean, do you do the same things? I mean, what kind of patients do you see?
We see many different kinds of patients. You see, we started practicing dentistry ever since 1995, right after the dental school. As a freshman, I worked in different types of dental clinics. Having a chance to see different types of practices, I came up with an idea to open a dental practice where all those different types of dental services could be provided under one roof.
Under one roof, you know, because people still don't like going to the dentist. Is that right?
Nobody does.
So do you hear that all the time? I don't like dentists?
Yeah. Some of them just say it on your face. I don't like dentists. Some of them are more polite. They say, I don't like going to a dental office. They actually say that to your face? I don't like dentists? They say that? Yeah. They do, and then they correct themselves. Oh, no offense, I just don't like to go to a dental office. Well, no wonder, because the history of dentistry was so painful. When somebody thinks about going to a dentist, they start wincing in pain.
Yeah.
But now everything is changed, though.
So under one roof, because
yes.
I guess sometimes you have to go to one person for one thing and another person for another thing.
Yeah, it's a tremendous service to dental patients.
So you do both?
We do everything, yeah.
That means you do the surgery.
We do the surgery.
And you put the tooth on top. And that's normally done by 2 different people?
Normally it is done by 2 different people.
Okay, dental implants, I guess, have become pretty popular, more and more mainstream. How long have you been in and around dental implants, and what's your training when it comes to those?
I learned and started placing implants when I was doing my internship in oral and maxillofacial surgery in 1994, 1995. But my main education and training comes from Loma Linda School of Dentistry Implant Department.
Okay, so they have an implant dentistry program at Loma Linda.
Oh yes, and that's one of the best in the United States, and I can say in the world.
Okay, why do you like dental implants?
I don't just like them, I love them.
Why?
Because they are like a magic wand to give a happiness to a patient.
How so? How so?
There is no other dental restoration that could last longer than dental implants and restore a fully functional and aesthetic tooth.
So it's like getting your teeth back. I mean, that's how you describe it. For the first time in history, I guess, with dentistry, you're not just patching things up, you're actually giving them something back.
When the tooth is lost, you're giving them a tooth, which is fully functional, exactly like their natural.
You say it's the happiest group of dental patients with all the different things you do.
Because when a patient has a missing tooth, they don't have to create some more problems grinding down neighboring teeth to restore that tooth. Or if the patient is wearing a denture, they get something stable. They don't need to take it out, put it back, and it functions fully like they remember what they had before.
So dental implants, they don't fall out. I mean, they stay in your mouth. They're strong.
No, they don't. They stay in your mouth, and they are tightly bonded to your bone. The bone grows, holds on to the dental implant like an anchorage.
What are the different categories, the different types of dental implant patients that you see in your practice?
We typically categorize patients based on their age groups.
Okay.
On one side of the spectrum, we have patients that are young, who have lost one or a few of their teeth due to an accident, for example. Or these patients may even have congenitally missing teeth that need to be restored. On the other side of spectrum, we have elderly patients, edentulous patients, patients who lost all of their teeth. There is another category of patients who don't necessarily have a tooth missing, but when they go to their dentist, the dentist tells tells them that these teeth need to go.
Okay, so it's dentures
these patients are trying to hold on to those teeth as long as possible, exacerbating the problem, making it even worse. Now they are faced with the choice of having a denture or implant restoration.
Okay, now you say people oftentimes have been told your teeth have to go and then they hold on to their teeth too long.
Yes.
Elaborate on that.
A lot of times because they have seen patients with dentures and they don't like that. Okay. They are trying to avoid the dentures. They usually tell me that I'd rather have my own teeth, no matter how bad they are, than having a denture that can fly out.
Okay.
What they don't know is that those teeth that need to come out, most of the time they are compromised due to dental decay or gum disease. Holding those teeth in the mouth can create some more problems.
So if they've been told by their general dentist your teeth have to go, okay,
yes.
so
then they have to go.
They're faced with dentures or dental implants, and you say 4 implants can give them something fixed in the lower and in the upper.
Yeah, with the latest technology, we can utilize only 4 or up to 6 implants.
Okay.
4 for the lower jaw, most of the time 6 for the upper jaw, to give them permanent fixed teeth that are not removable. They are removable only by their dentist.
Okay, now let's start with the 1 tooth. Going back, what's the big advantage? Why get a dental implant if you're just missing 1 tooth? What does traditional dentistry offer if you're missing 1 tooth, and what do you do?
Traditionally, we used to restore a missing tooth with bridge work attachment, which we call in dentistry fixed partial denture. Okay. That bridge work attachment requires grinding down healthy neighboring teeth that can create more problems. And after the bridge work attachment, since the bone underneath the bridge is no longer in use, it shrinks away.
All right.
That creates more problems for remaining teeth. With implants, we restore that missing tooth without touching neighboring teeth. And it looks, functions, and feels like a natural tooth.
So the next category of patients, they're missing, I guess, 3 and 4 teeth in the back.
Those people.
Why do they need dental implants?
They do need dental implants in order to prevent the further bone loss and further loss of teeth. Some patients chew with their, if they are missing teeth on both sides, they chew with their front teeth.
Now what about people, though, that they're fine, though, with, they're missing 3 or 4 teeth and they have what do you put in there, like a partial?
Partial denture. Okay. Traditionally, it used to be
so partial
denture.
They're fine, they have no symptoms. Why should they go in and do something about it?
Because
if they're fine.
Partial denture doesn't prevent a bone loss.
Okay, so the loss of the bone creates the rest of the mouth to collapse.
Exactly. Bone loss can make the face look sunken and aged.
Okay.
And it creates more problems for remaining teeth.
Okay, denture wears. Let's move on to denture wears.
Okay.
You say they benefit the most. Now, the denture wearer watching this, upper and lower denture, you say 2 dental implants can give them something that snaps in, snaps out. And you brought a model. What am I looking at there?
We have a model here showing a denture here with 2 implants.
Okay.
This structure we call overdenture, implant retained overdenture.
I'm going to take a look at
with
that.
These 2 implants.
And so it just snaps right on.
Yeah, it's snap in, snap out. Okay. The denture is removable.
So it's pretty accurate as far as how firm it is. And so can you use your own denture?
Yes, you can
put these little snaps?
Patients can use their own dentures. Usually we make new ones for them, but they can use their own dentures. The denture is removable here for cleaning and oral hygiene, but it is securely fixed on top of these 2 implants.
Can they eat meat with that? Can they eat?
Yes, they can. And this one restores the chewing efficiency up to 60%.
On the phone, you said that if there was a try-in period, that means if the denture wearer knew what they were missing, they couldn't go back to dentures. Like a weekend, try a couple of dental implants.
Even a day or 2.
Yeah.
They would never go back, for sure, 100%.
What do they say to you after the procedure is done?
They jump out of happiness, and we had a patient who walked out.
So you're looking at her out of?
Yeah, we were looking from behind the window. My office manager called me.
And the patient was jumping up and down?
Jumping up and down, checking her teeth in the back rear view mirrors of the car. And then, oh my God, this is so wonderful.
Because of dental implant. Okay, and it was dental implant?
Yes. We restored her 4 front teeth with dental implants.
So in the front, you could make them look real, because I feel like I could still spot dentistry. They either look like dentures or they look like a partial of some sort.
With implants, now we have opportunity to restore the front teeth that look more authentic.
Okay.
They don't look like dentures anymore.
Have you had
Exactly like
training
a
in
natural
cosmetic
tooth.
dentistry?
Yeah,
you take courses?
After taking the implant courses, I've gone to different places to take courses on cosmetic dentistry.
So if somebody is in their 80s, denture wear, because 80 is not so old today these days.
Not at all.
It's not too old for dental implants.
not
I mean,
at
they'll
all.
stick in there.
No, there is no upper limit, age limit for dental implants, to receive dental implants.
Seems very painful,
These kind
though.
of patients, pain is a thing of the past already.
Okay.
It's not painful at all.
They don't complain about pain.
It's not really the pain, it's the fear of pain already. Right now we are facing with the fear of pain. Patients, they don't complain of pain.
They don't.
First, they are scared. Is it going to be painful? That's one of the misconceptions in implant dentistry.
Comes up every day.
Yeah, it comes up every day.
And what do you say to them?
Well, we have patients who have needle phobia. We can use oral sedation. We can use nitro sedation. There is also IV sedation.
You do IV sedation as well?
Yes, exactly. And the patients are asleep during the procedure. They don't even remember if something was done.
But after the procedure, it seems so painful to go through this procedure. They don't. What do they take? What do you give them after the procedure for the next couple days?
We prescribe them Tylenol or Motrin, which would deal with the discomfort that they would have. I don't want to call it pain because implants go inside the bone, and the bone doesn't have the pain sensors. They could have some discomfort because of the local injections. Injected sites could be sore for a few days. But that's not painful. The patients don't need to be scared of that. It's just a little discomfort.
Okay, so when we do this, because people need to know also that this is a real interview, you're not scripted here, but pain is not something they complain about. Because I guess there is definitely discomfort in the procedure, but it shouldn't hold you back from getting it done.
First they are scared if it's going to be painful.
So they say that on the
then
consult.
They never talk about the pain.
Afterwards.
Ever. Yeah.
A few ibuprofen.
I mean, it wasn't painful at all. Sometimes, well, we usually call the next day or the day after to check how the patient is doing, and we always ask the question, "Have you had pain?" And none of them had pain. Some of them mentioned that we had some discomfort, but I took a tablet or two of Tylenol and it was gone.
Now, what about? Okay, then we talked about 80-year-olds, 90-year-olds getting dental implants, and you're saying that that's not too old. What if you have osteoporosis? My mother, she's 73 years old. She says her medical doctor said she was too old for dental implants, that they would fall out. Is that just not true?
That's not the case. Osteoporosis is more a disease of long bones, and it doesn't affect too much the facial structure and jaw bones. Patients who have osteoporosis, they are also candidates for dental implants.
We're going to take a quick break. We come back, more about, so we've talked about the snap in, snap out, and more questions about the fixed. You say 4 dental implants. In fact, you could do it in one day?
Exactly. In one day.
Teeth in a day. You call it all on 4 for the denture wearer. They could walk out that day.
It's amazing, isn't it?
With their teeth back. Okay, we'll be right back. I want you to take me through that process. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're discussing dental implants, a new procedure that is called All on 4, allows denture wearers with just 4 dental implants to have something fixed in their mouth. We'll be right back.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction. breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, a hot topic, a new procedure. It's called All-on-4. Denture wearers nationwide are losing their dentures, getting rid of their dentures, no more dentures, and getting 4 dental implants and getting something fixed in their mouth. This is, we're here with Dr. Baghdasaryan. Is that right? Did I pronounce it right?
Exactly.
Okay. And so this procedure, All-on-4, it can be done in one day.
In one day.
Describe the procedure and who's a candidate.
All-on-4 procedure is designed by Nova Biocare. During this procedure, we utilize the latest implants and 3-dimensional computer imagery and guided surgery to allow the patients to receive a fixed, fully functional teeth.
All right.
They are fixed. They are not removable. Are removable only by the dentist.
So 4 dental implants, but is that sturdy enough? I mean, could the critics say that's not enough implants to give them something secure in their mouth?
If you want to restore your wisdom teeth, that's not enough, of course.
Okay.
But in order to have a fully functional dentition, we don't need to restore wisdom teeth.
Okay, is that what that model is? Tell me what I'm looking at.
This model is not All-on-4, but it's easy to get the concept. It has 4 implants, and the bridge is permanently fastened on top of those implants.
Okay.
And the patients could
Let me take a look
chew
at that.
effectively on that.
Is this pretty accurate as far as how much strength it is? Okay.
You can remove that one. That's
so this is like 4 implants.
All-on-4 you cannot remove at all.
You call it an overdenture.
This one is overdenture.
You put it on, snaps it on, but you screw it in. The kind you're talking about screws on,
it's
and that's
different.
it.
Right?
Okay.
With overdenture, the structure is a denture. It has all these flanges.
So that is a
out.
snap-on, snap-out.
Snap-out
okay.
overdenture. With All-on-4, it's not a denture anymore.
All right.
It's a bridge.
Okay.
Okay. You can feel your gums from all around. It's a bridge fixed, and it restores the chewing efficiency more than 90%.
So if things change, I mean, our show's been out for 10 years. I mean, the old thought was you needed about 8 dental implants to secure something on the lower. That's changed.
Before we had to go open a flap, expose the bone to see where it goes in order to place an implant. Right now we have the 3-dimensional computer imagery that we can utilize. We see the bone.
So it's like a CD. I mean, it's a
exactly.
It's a CT scanner.
CT scanner.
So you're looking at their bone.
Dental.
Okay.
And then we have the 3-dimensional image in the computer. And then we design the surgery before the patient is in the office, before even doing it on the patient. We design the surgery, we make a surgical guide, and once the design process is over, the patients come for their appointment, and it takes about an hour just to.
So somebody walks in with no teeth.
No teeth.
Just a denture. And go to see
no
you.
No flaps, no scalpel, no cutting involved, no stitches.
Okay.
And then the patient goes out with the denture. With the bridge, implant bridge,
Fixed.
not a denture.
Fixed. This All-on-4.
Yes.
And how soon can they eat, though?
They can start eating immediately, but we usually recommend them to start with the soft food, soft diet for probably a week or so.
A week or so, and then what? They can eat an apple after that?
Anything, yeah.
Is that the #1 benefit, though, that you hear from the patients, the 60+, 70+ patients that are wearing dentures?
#1 benefit is restoring the quality of life of those patients. And
you say
after
they become
60, 70, most of them are retired, and their main work is socializing, going out with their friends. And,
Good point. Okay.
And when they have implants, implant teeth, they feel so secure. They can eat out with their friends instead of staying home with their dentures out, trying to avoiding people because of the fear that they may find out about their missing teeth or loose dentures. Those patients that have loose dentures, they don't feel secure.
Now the upper denture,
we take that insecurity away.
But aren't they snug? I mean, if you have an upper denture, isn't it snug? So why would they want to lose that and go with what you're talking about?
Even if it if it's snag, eventually it will become loose because of the further bone loss. But the main problem with that is that the whole palate is covered with all that massive plastic.
With a denture.
With a denture. And since the palate is covered, patients are having some trouble enjoying some of their favorite food. It doesn't taste the same when you're chewing with your tongue and your palate. Palate is covered. With implant restorations, the whole palate is open. They can enjoy their favorite food.
Logically, this makes sense. I mean, you know, denture wear's out there. How, if it's as good as you're saying it is, why aren't they all running in to do it?
Because
it's a fair question. I mean, 20 million people have dentures, according to the internet.
Yeah, more
so
than
why aren't
20
they all
million.
doing it if it's this
Because
good?
they haven't been to a dentist for a long time. Since they don't have teeth, they have dentures. And since they haven't been to a dentist long time, they don't know about the latest advancements.
So your feeling is nobody is suggesting that they do it?
No.
So they're not doing it? all on four. Should they ask specifically
all on
for
four?
All on four?
That's the name of that procedure. All on four.
And that's just 4 on the upper. You say 6 on the upper.
6 on the upper. 6
and 4
is
on the lower.
Preferable on the upper because some patients have stronger lower jaw, and the upper jaw is more porous, which is doesn't have that dense of a bone to place for implants.
And it does not hurt for the most part. I mean, that's not something they complain about. Pain. They could be IV sedated or oral sedated.
After IV sedation, they don't even remember. Sometimes they wonder if something was
now,
done.
70, you're in LA, is very young. I mean, 70 is young. And you say that these people are dating, and they're ashamed that they're wearing dentures.
Randy,
I tell you this.
there is the reality in our society that absolutely no one will tell you about is that how you look does make a difference on how you're treated.
Okay.
Research shows that attractive people get better places in restaurants, are paid more, have better relationship with their spouses. They even get better deals while shopping.
All right.
And there are so many people that go through life.
And they don't like their smile.
They don't like their smile. Or they would want to, or they like their smile, but they would want to make it even better. And for those patients, implants are the choice.
So for the denture wearers, that they look like they're wearing a denture, makes them look older, I think, sometimes
it
too.
Does. Because of the bone loss. The bone loss makes the face look sunken. And
it sinks in.
And
this stops that? I mean, by getting dental implants, what, it's the pressure of the dental implant that
stimulates the bone, it doesn't let it shrink. Implant, like the root of the tooth, stimulates the bone, keeps it on its level, doesn't let it shrink. When the bone is not in use, it shrinks.
What are their other questions? I guess cost, they usually count all their teeth?
Oh, there is this misconception about the cost too. Some patients think that it is expensive. But the research shows that during the lifetime of a patient, restoring the tooth with the dental implants is much cheaper than restoring that tooth with any other type of dental restoration, considering the long-term complications of that restoration.
What if somebody's watching this and they're wearing a denture and they're fine? They're saying, I'm fine.
We all say, I'm fine, but inside we don't know how fine can we be.
Okay.
Any denture wearer can benefit the most. With the dentures, even efficiency of chewing is only 10%. With the implants, it can go up to 90%.
So it is like getting your teeth back.
I had a patient who was a manager in a good company. He came one day very embarrassed about his dentures, and he said that this is it, I'm done with my dentures, I don't want them anymore. And I said, do something permanent about it. His story was that he was in a board meeting, and somebody told a joke, and it was a good joke, obviously, and he couldn't help but laugh, and his dentures jumped out of his mouth. He says that he lost his his authority, his dignity, and he was humiliated in front of everybody. I mean, I could feel the pain in his eyes.
So somebody, I guess, has a certain level of that. If it hasn't happened to them, maybe in the back of their mind they're thinking that this could come out. I mean, did they say that to you?
All of them, all of them. Patients who have denture wearers have also this, their facial structure is different. Some of their muscles are tense, trying to keep those dentures in the place.
Okay.
And they can not laugh and smile as freely as they would if they had a permanent teeth. And the denture wearers should know that those dentures will not stay there for a long time. Over time, it will become more loose. Eventually, they will face the problem of making either new denture or doing a multiple reline which will not get rid of the problem.
So go in there and get evaluated. I guess that's where it
Yeah.
all starts.
Mm-hmm. And the other type of benefits, they will stop using the denture adhesives. They will feel they will not have that massive plastic in their mouth. They won't need to take it out and put it back on. And for the
So they don't like that. Is that? I mean, that's what you hear.
They don't. Oh, nobody likes their dentures. And for the denture wearers, my message would be just stop being a victim of those loose and uncomfortable dentures. Just stop being a victim.
Okay.
And with nowadays technology, we do have the ability to restore your teeth
in one appointment
and make a denture that will not pop off or move around or jump out of your mouth.
So
every
all
time
on
you
four.
laugh, you're all on four.
So your offices in LA are in Van Nuys?
Van Nuys and Glendale.
Okay.
The Van Nuys office, my wife is working in
your wife?
Van Nuys office, and I work there too Mondays. And the other office where I mainly work most of the time is in Glendale.
You've been in LA for a long time, went to USC for a while.
Yes, I went to USC to get my education on IV conscious sedation with Dr. Stanley Malamed.
So they could be out completely, nothing to be afraid of, I guess?
Not at all, not at all.
Final message, somebody watching this and they're still afraid, they're very skeptical that 4 dental implants could give them something fixed in their mouth. What do you say to that patient? They're afraid of the dentist.
I would like to invite them in, check our website and come to us for a consultation. It's complimentary.
They meet with you?
Exactly. We'll sit down and talk, and I will give them all their options and all the advancements in implant dentistry. There is nothing to be afraid of.
So you like being a dentist? You've always wanted to be a dentist, you say?
I wanted to be a
dentist. Since 13 years old?
Ever since I was in elementary school.
Okay.
My family, I grew up in a family that was very involved in medicine. And when I was a kid, my grandmother had some teeth problems. And I remember her, once she told me that when I grow up and become a good dentist, I will rescue her from all that suffering.
So that motivated you to be a dentist?
That became a motivation for my career choice, a purpose for my career choice.
Good.
And right now, she's long gone now, and every time I finish the implant treatment for elderly patients, somebody else's grandmother, and make them happy, I remember my grandmother, how happy she would be if she had that kind of treatment readily available back then, about 30, 40 years ago.
Well, good for you. Well, I want to thank you for coming to the show. Very interesting.
Thanks for having me.
Great information. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you could visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.